Dr. G, and today I want to talk to you about what things might you look for if you had parasites. Now, the first thing is don't get grossed out. Over one third of the world population has parasites, and you'd be surprised at all the symptoms parasites can cause. Most of us think of gut issues, but it's not just the gut that we can have problems with. Um, let's imagine there's somebody who's taking your energy, right? So, of course, there can be fatigue and sometimes even fever, loss of appetite, dehydration, malnutrition, abdominal pain and cramping, diarrhea, constipation, nausea and vomiting, bloating and gas. But many people will have all these things and then they'll be diagnosed with irritable bowel syndrome rather than somebody saying, maybe you have parasites because they are super common. Parasites not only can cause gut troubles, including both ends of the spectrum, diarrhea and constipation, but they can cause skin rashes, itching, hives, swelling around the eyes, muscle aches, joint pain, difficulty sleeping, irritability, mood changes. Oh my gosh, the list goes on and on. Coughing, respiratory symptoms, headaches. We think, oh, well, I've never seen any worms in my poop. I must not have parasites. The fact is, some of these guys are super small, you guys. So it doesn't matter if you've never seen visible worms in your stool. Maybe you have an itchy bottom, and itchy anus can sometimes be a symptom of worms. Nutritional deficiencies related to malabsorption because somebody else is eating your food. And in case of kids, sometimes they won't grow as fast because somebody else is eating their food. Now, there are also parasites that are present in the blood and in our tissues, and those can cause very high fever, chills, and sweats, swollen lymph nodes, enlarged spleen, yellowing of the eyes and skin, and dark urine. Sometimes people can have parasites that affect their brain, and they can have mental confusion and coma. Um, if parasites get into your lungs, we're going to have coughs, chest pain, shortness of breath, sometimes even coughing up blood. Oh my gosh, I'm sorry to even have to tell you this. There also are parasites that will just affect the skin, and you might see a snaky like track on the skin that is itchy and red. Skin parasites tend to cause a lot of itching, right? Sometimes you might have red bumps, blisters, or even swelling and pain. The parasites that affect the eyes, like toxoplasmosis and onchocerciasis, those tend to cause real problems with the eyes in terms of like pain, blurry vision, redness, vision loss in severe cases. And if somebody has a parasite affecting the brain, they can even see seizures, behavioral changes, neurological deficits. So the important thing is if you're trying to turn over every stone and figure out what the heck is wrong, you have to at least consider parasites because most of us have been exposed to animals, to dogs, to cats, and some of these are borne by vectors. That means, malaria is a parasite that's transmitted by mosquitoes. Not common in the United States, but common in other places. And now this is becoming a more and more international community. So we really have to think about all of these and not just say, oh, there's no parasites here. The fact is that people who are evaluating stool samples for parasites, they have less experience than we would like and they can be difficult to discover, difficult to identify, and parasites cycle. So they're not always going to be shedding in the stool, and you may not see if you have parasites, even on a test. So watch my next video and I'll tell you a little bit about what you can do if you're wondering, could I have parasites? How can I manage this? One thing I also want to mention is that if you have severe allergies or have blood tests that show high eosinophils or high eosinophils and basophils, especially if you're someone who's getting a lot of allergy treatments, you may want to do some DIY parasite treatment because what if all of the allergic symptoms that you're experiencing are actually coming from parasites? It's possible, I've seen it happen. I've seen a person's asthma resolve after parasite treatment. I've seen a person's sinusitis resolve after parasite treatment. I've seen rashes go away. I've seen it's amazing what can be improved, and, it's also one of those things that it's not very difficult to do. Check out my next few videos, and I'll give you a little bit of tips on that. All right. I hope this has been helpful for you, and